Hey everybody, welcome to the show. Wow, it has been a crazy couple days, hasn't it?
Goodness gracious.
Whew, let's all take a deep breath together, and things are a bit chaotic. We're going to start the show, and we will go until President Trump takes the stage. But for now, I want to introduce Miss Jessie Shepard. We called Jessie and we said, hey, you got to come in, you got to talk to us because she's a mental health counselor, and everybody's stressed out right now. So what in the world do we do? What are our first steps to take, Jessie?
Well, first, we don't want to panic.
Yes.
So what happens when we get consumed with our panic, fear, or we're getting worried? The frontal lobe of our brain actually dims significantly, making it where we can't make rational decisions.
And I 100% agree with that because I think things have been so tense the last couple of days. Physically, I felt like I couldn't move as fast. I felt like, I mean, it just seems like everybody's shutting down, right?
Well, and the behaviors of other people have been very surprising, where you're at the grocery store and people are arguing over toilet paper, and it's like, what is happening? We should be sharing these things as a community, right? But because of that frontal lobe being off, we're not making rational decisions and we're not having social etiquette. So it's important that we're taking that time to calm ourselves down before we're making decisions like that, because we want to make rational decisions as we move forward.
I like it. Now, you've got this full screen and some great things for parents to do with their kids or if they're a caregiver.
Yes. It's important that we're talking to our kids. Our kids are getting a lot of information, usually misinformation from the friends on the playground and that kind of thing. So we need to talk to them, we need to reassure them, and we need to be understanding of their emotions as well, because they are not in control of their environment.
True.
So we want to hear them out and consider all of their emotions, along with being understanding that there might be regression, like bedwetting might be starting to happen, or acting out, or even completely pushing us away and isolating themselves. It's very, I mean, if we're all having these upset emotions, of course our children are.
Exactly.
So we need to make sure that we're noting that and we're addressing that with them.
And if we're managing our stress levels and everything, I mean, obviously people have been running to the stores for those emergency supplies, but let's be realistic about it, right? What do we need to do?
Well, so prepping wise, I'm not going to give you a list because there's plenty of lists out there, but it's important that we're not putting ourselves in any type of financial danger or over hoarding stuff. So we need our neighbors to have hand sanitizer as well as we need it, right?
True.
Because
we've all got to share, people.
Right. So we want to make sure that everybody has the supplies that they need, because we are a community. We're not individuals, we're a community.
And yesterday, I thought at the press conference with Governor Herbert and all the health officials, they did such a good job at saying, hey, Utah, we are an amazing community and we are such great supporters of each other. Let's all use that to our benefit and let's be mindful of things, but let's all help each other. And I thought they did a really good job with that, because there's hysteria. You know, people are just throwing things into their cart.
Well, you and I were talking about at the grocery store, like the shelves are bare.
They're bare.
What are we going to do if everybody else has the toilet paper, right?
Exactly.
So we want to make sure that part of media coverage is that we're specifically looking for folks who are reputable and that have the good information.
100%.
We don't want to go on Facebook and have the friend of a friend of a friend who's saying statements, because that's misinformation. So the CDC, the World Health Organization, you know, Fox, making sure that we have specific guidelines about how we're supposed to move forward.
I like it.
And with that, we want to try to keep as much routine as possible. I know that a lot of kids' school districts are being closed, and so we want to be conscious of that, continuing routines, putting them to bed, reading books, being silly, all of those things that are so important, because routines create comfort. So our households should stay within those routines as well.
Yes, trying to live our normal lives, laugh with friends, talk with people, call your friends and your family, go to those gatherings, but be smart about it and wash your hands, and don't go to large gatherings, obviously, but try and keep those, like you said, try and keep it normal.
Keep those contacts open, because we want to be able to have those conversations with people, because it is kind of a scary time. But if you're able to communicate with others, you're more likely to stay calm.
Yeah, and this is just tip of the iceberg with all the information that we've got, but I have a feeling that there's people out there watching that may want to reach out to you personally and say, hey, what do I do? My son is doing this, or my daughter, or friend, family member, whoever it may be. If they do want to, how can they contact you?
If you go to jessiethetherapist.com, you can get a hold of me. And we also have telehealth information as well, so if you need that, because we might be quarantined. So
you never know.
You never know. So we you never know. There's always options.
We might be Skyping with you here shortly.
That'd be great.
You know what? The show must go on, right, people?
Absolutely.
Jessie, you're the best. Always good to see you. And follow her Instagram as well. She's always great to post some great things. So appreciate it.